So I'm the Program and Product Evaluation Lead at NPS MedicineWise. So my colleague Rachel Holbrook and myself have developed up an approach to evaluate Choosing Wisely Australia. So the approach is here, and it includes both process and impact evaluation. So for process evaluation, we'll be looking mostly at measuring the key performance indicators or the targets that have been set for the program. But also an important aspect of process is media analysis. So the media is a really important aspect of the Choosing Wisely initiative. So each year we're looking at doing an analysis of where media mentions are, in what sort of media, is it trade or is it consumer, what sort of messages are appearing in the media about Choosing Wisely, are they the key messages that we're intending to have put into the media, and also is the media, what is the tone of the media, is it favourable, unfavourable, neutral, that kind of thing. In terms of impact evaluation, we've got quite a few things that are coming up, including a qualitative evaluation of the 5 questions resource, which I think is a fairly new thing for Choosing Wisely, and we'll be doing that with some of our partner health services. But the main ones I wanted to focus on today, which is where we have our key insights from to date, are the health professional surveys that we've been doing annually. So we've been doing those with GPs, with specialists, and with other health professionals like pharmacists and nurses. And that's really to look at trends and changes in attitudes, behaviours and knowledge with regards to medical tests and procedures. And we've also included questions in our National Consumer Survey. So we included baseline questions in our 2016 National Consumer Survey, and we'll be doing comparative questions in our 2017 National Consumer Survey as well, just looking at attitudes, knowledge and behaviours of consumers with regards to medical tests. And another important part of our evaluation approach is partnership analysis. So we're really looking at getting feedback from representatives of our member organisations, so all of you professional colleges, associations, societies that are a part of Choosing Wisely. We're doing a survey each year of the program, and we really value your feedback as a part of that. So the next few slides I'm going to go through are just some key findings that we've had to date from our evaluation. So the first one is on a very positive note, is that awareness of the Choosing Wisely Australia initiative has increased significantly over the life of the initiative. So for GPs, it started off at 19% pre-launch and is now at 59% awareness of Choosing Wisely Australia. And for specialists, from 27% pre-launch up to 49% in year 2 of the program. So we hope that this is a trend that will continue. So the proportion of health professionals who strongly agree that the use of unnecessary tests, treatments and procedures is a problem in Australia in medical practice has increased significantly over the 2 years of Choosing Wisely program. So for GPs, that's increased from 29% in year 1 to 35% in year 2, and for specialists from 32% in year 1 to 46% in year 2. So health professionals who believe that they have a responsibility to help reduce the use of unnecessary tests, treatments and procedures has also significantly increased over the 2 years of the program. For GPs, we've seen an increase from 36% to 47% in year 2 of the program. And for specialists, we've seen a 10% significant increase in those that strongly agree that they have a responsibility to help reduce the use of unnecessary tests, treatments and procedures. So we've found that health professionals who have engaged with Choosing Wisely actually feel that they have a greater level of influence in their workplace to reduce the use of unnecessary tests. So for GPs, we've seen just a slight increase to date in those that say they have a high level of influence. But for specialists, we were able to look at baseline data. So it was 28% of specialists before the Choosing Wisely Australia initiative started felt that they had a high level of influence in their workplace. Now we're in year 2 of Choosing Wisely. 41% of specialists believe that they have a high level of influence in their workplace to reduce unnecessary tests, treatments and procedures. So that's a positive trend again. So patient demand is a very big concern for health professionals at the moment, as I'm sure you'll probably all be aware. So we found in our surveys that a quarter or more health professionals perceive that patient demand for unnecessary test treatments and procedures actually occurs on a daily or weekly basis. So for GPs, 24% of them were saying that they were being asked by a patient every day for an unnecessary test, and 39% said that they were being asked several times a week. For specialists, this was less of an occurrence, but still 23% were asking specialists for an unnecessary test several times a week. So we asked GPs what do they do, and do they actually attempt to discourage the request of unnecessary tests, and 70% told us that they do attempt to discourage patients who have asked for an unnecessary test or treatment. However, they've said to us that there are still a number of reasons why they would request a test, treatment or procedure even though they felt it was unnecessary. And for GPs, the biggest reason was patient expectations. So they felt that they either had patients coming in demanding tests that they felt were unnecessary, or their patients' behaviour suggested to them that they wanted or required something in order to close the consultation, and that might be a request for a test or referral to a test. And so it was a very big concern for GPs in terms of patient expectations. There was also concerns that a patient might leave and go to another practice if they weren't given the tests that they were requesting. Also a big concern for GPs was the potential for medical litigation. So GPs were still worried that if something happened to a patient and they hadn't referred or requested all of the available tests, then they could be potentially liable for that. So that's still a big concern for GPs. For specialists, the number one reason why they might request an unnecessary test was difficulty accessing information from other health professionals. So again, that's showing that there's still a gap there in terms of relationships and communication between specialists and GPs, but also specialists within different specialities as well. So in our latest GP and specialist surveys, we asked a question that was similar to one that was used by Choosing Wisely Canada, and it asked health professionals about barriers to implementing Choosing Wisely recommendations. So what you see on the slide here is an example of one recommendation, Australian recommendation on benzodiazepines, but we asked a series of questions about different recommendations. So for this particular one, we found that 40% of GPs and 22% of specialists felt that there were minor barriers to implementing this particular Choosing Wisely recommendation, and 17% of both GPs and specialists felt that there were major barriers to implementing this kind of recommendation. So I think there's still, well, what we found is that in practice, there is still some work to be done in terms of overcoming perceived barriers to be able to implement these Choosing Wisely recommendations. And some of the barriers that were mentioned to us by GPs and specialists were things like having adequate time pressures, patient expectations, and as well as patients and patient symptoms that don't necessarily fit the guidelines. And so then what do they do then? So in terms of consumers and what we found from our first consumer survey, consumers typically agree with the concept of reducing unnecessary tests. So we found that 71% of consumers agreed that people have a responsibility to help reduce the use of unnecessary tests. However, this was not aligned with their preference for more tests when experiencing an illness. So 3/4 of consumers actually believe that if they're ill, their doctors should conduct all available medical tests. So there's a bit of a gap there between what they know people should be doing, but then what they would do in a situation that was personal to them. And we found that only 33% of consumers believe that having unnecessary medical tests may be harmful to their health. So there's further education needed in that aspect. And what we actually found was that consumers who were aware of Choosing Wisely Australia were actually significantly more likely to be aware of the risks of having medical tests. So we conducted a member survey, the partnership analysis that I was talking about at the start, at the end of year 1. We've got another one scheduled at the end of year 2. And what we found was that the majority of our members are satisfied with engagement with NPS. 100% were satisfied with the feedback that NPS provided on the recommendations and supporting evidence. And 82% cited a shared commitment to achieving the goals of Choosing Wisely Australia. So that's great news for all of us, I think. The member survey will be conducted each year of the initiative, which is especially important for us as we get new members coming on board, but also as our current members go through and progress with implementing their Choosing Wisely activities. So if you're a rep from one of our member societies, organisations, colleges, please give us your valuable feedback if you see a survey come through your inbox from us on the stage. And I just want to thank the people who have been involved in this. My colleague Rachel Holbrook, who is the Choosing Wisely Evaluation Lead for NPS MedicineWise and couldn't be here today, as well as the Choosing Wisely Advisory Group, Robin and the Choosing Wisely team at NPS MedicineWise, all of the health professionals and consumers and members who completed our surveys, and of course, all of you for listening today. Thank you.